Hello friends, welcome back to MZK Educare. Today in this session, we will solve MCQs related to CPR. Question number 1. What is the full form of CPR? Option A, cardiac pressure response. B, cardiopulmonary resuscitation. C, cerebral pulmonary reaction. D, circulatory pulmonary response. And the correct answer is option number B, cardiopulmonary resuscitation. The full form of CPR is cardiopulmonary resuscitation. CPR is used to restore breathing and circulation during cardiac arrest. Next, what is the first step in CPR according to BLS guidelines? Option A, check breathing. B, check responsiveness. C, verify scene safety. D, start chest compressions. So in BLS guidelines, we have 5 steps. According to BLS guideline, we have 5 steps. First step is, step number 1 is verify scene safety. Verify scene safety. Step number 2, check responsiveness. Responsiveness. Step 3, we have call or activate emergency medical services. Activate emergency medical services. 4, step number 4, we have to check pulse and breathing simultaneously. Within 10 seconds. And step number 5, begin or start high quality CPR. High quality CPR. Clear? So here the question is asking the first step in CPR according to BLS guideline. So the correct answer will be option number C, verify scene safety. The 5 steps of CPR. Step 1, verify scene safety. Step 2, check responsiveness. Step 3, activate emergency medical services. Step 4, check pulse and breathing simultaneously within 10 seconds. Step 5, begin high quality CPR. Next, what is the correct compression to ventilation ratio in adult CPR? Option A, 15:2, B, 30:2, C, 20:2, D, 10:1. And the correct answer is option number B. 30:2 is the correct compression to ventilation ratio in adult CPR. Next, what is the correct compression depth for an adult? Option A, 1 inch, B, 2 inch or 5 centimeter, C, 3 inch or 7.5 centimeter, D, 4 inches. And the correct answer is option number 2 or option number B, 2 inches or 5 centimeter compression depth for an adult. Why this compression depth is important? Because it helps maintain adequate blood flow. Clear? Next, what is the correct hand placement for adult chest compression? Option A, lower half of the sternum. B, upper sternum. C, over the left nipple. D, below the xiphoid process. And the correct answer is option number A. Lower half of the sternum is the correct hand placement for adult chest compression. This correct chest compressions, correct placement of hand during compressions, it ensures effective compressions. Next, what is the recommended rate of chest compressions per minute? Option A, 60 to 80, B, 80 to 100, C, 100 to 120, D, 130 to 150. And the correct answer is option number C, 100 to 20 compressions per minute. Next, what is the correct sequence of CPR steps? Option A, ABC, B, CAB, option C, BAC, and option number D, BCA. And the correct answer is option number B, CAB. That is circulation, airway, and breathing. Circulation or compression, then airway, then breathing. CAB. Next, how long should you check for a pulse? At least 20 seconds. B, not more than 10 seconds. C, 30 seconds. D, 5 seconds. And the correct answer is option number B, not more than 5 seconds. Because checking the pulse for too long, it delays compressions. So we need to check within 10 seconds and not more than 10 seconds. Next, when should you call for emergency help during CPR? Option A, after 1 cycle. B, immediately after checking unresponsiveness. C, after 5 cycles. D, after 2 minutes. And the correct answer is option number B, immediately after checking unresponsiveness. I have mentioned in the previous slide the 5 steps of BLS. So their first step is verify sensitivity, second is check responsiveness, and after check responsiveness we have to activate emergency medical services, and after activating emergency medical services we have to check for this pulse and respiration simultaneously within 10 seconds, and then we have to begin high quality CPR. So these are the 5 steps of BLS guidelines. So the correct answer is option number B, immediately after checking unresponsiveness we have to call emergency or activate emergency medical services. Next, what is the location for checking a pulse in adult? A, radial artery, B, femoral artery, C, carotid artery, and D, brachial artery. So during cardiac arrest in an adult patient, we check for what? Carotid pulse. So option C is the correct answer. For adult, we check carotid pulse, and for children, we check femoral pulse in children, and in infants, we check brachial or femoral. Infants. Because the carotid artery is easiest to fill during cardiac arrest in adults. And in children, femoral pulse, and in infants, brachial or femoral pulse. Next, when giving rescue rates, the chest should A, partially rise, B, fully rise visibly, C, not move, D, collapse slightly. So there are 5 components of high quality CPR. High quality CPR. So the first is chest compression fraction. Chest compression fraction more than 80%. And the second step, we have compression rate of 100 to 120 per minute. Compression rate should be 100 to 120 per minute. Third, chest compression depth should be at least 2 inches or 5 centimeter in adults, and 1.5 inches or 4 centimeter in infants. 5. Allow complete chest recoil. Allow complete chest recoil. 5th, avoid excessive ventilation. So the question is, when giving rescue rest, the chest should, the correct answer will be B, fully rise visibly, because in the 5 components of high quality CPR, in the number 4 we can see we have to allow the chest to recoil completely. So we have to allow the chest to fully recoil. Next, how often should rescuer switch during 2% CPR? A, every minute. B, every 2 minutes. C, every 5 minutes. D, after 10 compressions. And the correct answer is option number 2, every 2 minutes or 5 cycles. The rescuer should switch during 2% CPR every 2 minutes or 5 cycles, because switching every 2 minutes, it prevents fatigue. Next, what is the compression depth for infants? Option A, 2 inches. B, 1.5 inches or 4 centimeter. C, 2.5 inches. D, 3 inches. And the correct answer is option number B, 1.5 inches or 4 centimeter. Already discussed before this one. Next, which rhythm is shockable? A, asystole. B, ventricular fibrillation. C, PEA, that is pulseless electrical activity. D, sinus bradycardia. So we have only 2 shockable rhythm. Only 2 shockable rhythm. One is PVD, that is pulseless ventricular tachycardia or pulseless VT. Number 2, VF or ventricular fibrillation. Ventricular fibrillation. So the correct answer is option number B, ventricular fibrillation. So we have only 2 shockable rhythms, that is pulseless ventricular tachycardia and VF, that is ventricular fibrillation, and all other rhythms, abnormal rhythms are not shockable. Next, what drug is given during CPR for asystole? Option A, atropine, B, adrenaline or epinephrine, C, amiodarone, D, lidocaine. And the correct answer is option number B, epinephrine. Epinephrine is given because it increases coronary and cerebral perfusion during CPR. Next, what is the purpose of defibrillation? Option A, start the heart rate, B, stop abnormal rhythm and restore normal rhythm, C, slow heart rate, D, increase blood pressure. And the correct answer is option number B. The purpose of defibrillation or shock is to stop abnormal heart rhythm and to restore the normal heart rhythm. Clear? Next. Question number 17. What should be done immediately after delivering a shock? Option A, reassess pulse, B, resume CPR immediately, C, give medications, D, stop all activity. And the correct answer is option number B, resume CPR immediately. So after giving a shock, we have to resume the CPR immediately, because it helps us to maintain the circulation of blood. Next question. What is the ideal time to deliver the first shock in cardiac arrest? Option A, within 2 minutes, B, within 5 minutes, C, within 10 minutes, D, after 15 minutes. And the correct answer is option number A, within 2 minutes. So the ideal time to deliver the first shock in cardiac arrest is within 2 minutes. Because early defibrillation, it significantly improves survival rates. Next, which of the following indicates high quality CPR? Option A, shallow compressions, B, interruption over 15 seconds, C, full chest recoil, D, slow compressions. We have already discussed about the 5 components of high quality CPR. So here the correct answer will be option number C, full chest recoil. Let us review again the 5 components of high quality CPR. Number 1, we have chest compression fraction should be more than 80%. 2, compression rate should be 100 to 120 beats per minute or 100 to 120 compressions per minute. 3, compression depth of at least 2 inches or 5 cm in adults and children and 1.5 inches or 4 cm in infants. 4, we have to allow the chest to recoil completely or fully. 5, avoid excessive ventilation. Clear? So allowing the chest to recoil completely, it improves venous return and perfusion. Next, during CPR, avoid A, minimize interruptions, B, overventilation, C, high quality compressions, D, proper hand placement. So during CPR, we have to avoid overventilation, because the overventilation, it increases intrathoracic pressure. So when the intrathoracic pressure is increased, there will be reduced in venous return to the heart. Next, what is the compression depth for children? A, 4 cm, B, 5 cm and 2 inches, C, 3 cm, D, 6 cm. And the correct answer is option number B. So the compression depth for adult and children is 5 cm or 2 inches, and for infant is 4 cm or 1.5 inch. Clear? Next, What should you do if an AED, that is automated external defibrillator, advises no shock? Option A, stop CPR. B, continue CPR for 2 minutes. C, deliver a shock anyway. D, remove. So option number D is remove AED. So what should we do if we see no shockable rhythm in AED? Should we continue CPR or stop CPR, or should we deliver a shock anyway, or should we remove AED? So the correct answer here is option number B. So when we see non-shockable rhythm in the AED, we have to continue CPR for 2 minutes. And again, then we have to analyze the rhythm. And if the rhythm is shockable, then we have to give the shock. And if the rhythm is not shockable, then we have to continue the CPR. Next, which of the following drugs is used for shockable rhythm after the third shock? Option A, epinephrine. B, amiodarone. C, atropine. D, lidocaine. And the correct answer is option number B, amiodarone. Amiodarone is given or used for shockable rhythm after the third shock. Next, what is the correct ventilation rate with an advanced airway? A, 1 breath every 3 seconds. B, 1 breath every 6 seconds. C, 1 breath every 10 seconds. D, 2 breaths every 15 seconds. So the correct answer is option number B, 1 breath every 6 seconds. So when this advanced airway is placed, we have to give only 1 breath every 6 seconds to avoid excessive ventilation. Clear? Next, during CPR, if the patient regains pulse but not breathing, what should be done? Option A, stop CPR completely. B, continue rescue breathing. C, continue full CPR. D, deliver shock. And the correct answer is option number B, continue rescue breathing. That is 1 breath every 6 seconds until normal breathing returns. Next question, what is the compression technique for infants during two rescuer CPR? Option A, one hand technique. B, two thumb encircling hands technique. C, two fingers. D, palm compression. And the correct answer is option number B. So when there is two rescuer for infants during CPR, we have to use two thumb technique, encircling hands technique. Clear? Next, what should be done if the chest does not rise with rescue breaths? Option A, continue breaths. B, reopen airway and try again. C, stop CPR. D, check pulse. And the correct answer is option number B. We have to reopen the airway and try again when the chest does not rise with rescue breaths. Next, which artery is checked for pulse in an infant? A, carotid. B, radial. C, brachial. And D, femoral. And the correct answer is option number C, brachial. Carotid pulse is checked in adult, brachial is checked in infant, and femoral is checked in the children. Clear? In infants, the brachial artery is best due to accessibility. Okay, next, what is the compression to breath ratio in two rescuer infant CPR? So when we are giving CPR to the infant in presence of two rescuer, so how many compressions to breath we should give? Option A, 15:2, B, 30:2, C, 10:2, D, 20:2. So when there is two rescuer in infant CPR, the compression to breath ratio is option number A is the correct answer, 15:2. And in adult CPR with 2 rescuer and in child or children CPR with 2 rescuer, the ratio will be 30:2. With single or double, the ratio will be 30:2. And in infant, in single rescuer, the ratio will be 30:2, and in double rescuer 15:2. But in children and adult, whether it be a single rescuer or a double rescuer, the compression to breath ratio is the same, that is 30:2. Clear? Next, what is the best indicator of effective CPR? A. Chest movement. B. Rising oxygen saturation. C. Carotid pulse during compressions. D. Color change. And the correct answer is option number C, carotid pulse during compression. So the best indicator of effective adult CPR is carotid pulse during compressions. So the palpable pulse during compressions, during adult compressions, indicates adequate perfusion. So thank you everyone. If you like my videos, kindly subscribe my channel.